Hello, everyone. Welcome to the Infection Control Exchange. I'm your host, Wayne Tucker. And this episode, we're going to focus on infection prevention and control and construction. So it's going to actually, there's still a fair bit to cover. So I decided to do a three-part series for this episode, like I said, on construction and infection prevention and control. So I'll start off for this episode. Part one will be more general, and then parts two and three we'll get into more focused parts of the talking about construction and infection prevention and control. So it'll be a great series. Like I said, there's a lot to talk about, and we'll get started. So the topic for this part one is importance of designing building infection controlling right from the start. So right from day one, I've talked about it in more general terms and other, like one or two other episodes. But this one is more focused just on the construction and the importance of incorporating it into infection prevention control from the very start. Unfortunately, that doesn't always occur, and continue to see it built in much later in the process, which is not the correct way of actually doing it. And this should be right from when you're starting the design phase. So a meeting with the designer or the architect. So let's get started. Um, and so we'll do the three parts to it. It is actually there's so much to talk about with it. And this is why I decided to do the three parts to it. So one of the probably I think the most common mistakes actually, which I've kind of already talked about a little bit, is just involving IPAC too late in the process, and that creates kind of ripple effects. Creates a number of problems and creates difficult to change it later on, um, without it being very expensive to do so. So you want to avoid that common mistake and involve infection prevention control right from the start. Like just once the decision got made to do either a new building, new construction, whether it's acute care or long-term care or major renovation or small renovation, you should be uh, involving the infection prevention control staff into the process from the very start. So um, we don't always see that, unfortunately, but that is the way it should be done. So it's going to be, there's a lot of design parts to infection prevention control, selection of the materials, the layout, where you're putting your different rooms, whether it's going to be shared rooms. It is, there's a lot to infection prevention control when it comes to construction. So, and if you don't handle that risk right from the start and things get missed, and like I said, it's very difficult to change and very expensive to do so. Many things can be changed. Some things cannot be easily changed if you don't incorporate IPAC in there right from the start. So, what are some of the implications of involving infection prevention and control late in the process? So, um, you know, when you look at the drawings and when the uh, is finalized, problem with it is that um, if you don't incorporate it in right from the start, you're losing all those opportunities to change things right from significant larger issues, like I said, either patient or resident room being shared versus everyone having their own room. Um, Obviously, having your own room is much better from an infection prevention and control perspective. Um, Whereas shared rooms, the risk is there definitely for roommates or anybody to sharing a room. So whether that's in acute care or long-term care. Um, so that's kind of like a big issue. And then there's a variety of many bigger issues that reason why you want to build in design right from the start. And I've already alluded to that. If you don't, then some of these things you can't really change later. If you've gotten done in your long-term care home all in shared rooms, well, um, you're not gonna go back and redesign that or change that later on because that would be just too expensive to make that change. So um, you want to kind of like, you know, section prevention and control. You want to focus on proactive approach when it comes to new construction and infection control, as opposed to like a reactive. So you want to build in it right from the start, and it takes a fair bit of considerable effort to undo. It is not a quick decision or just one or two decisions. It's many decisions that need to be made throughout the construction process, starting right from the start with the designer or the architect for the project. So, um, and the more time that you put into it, the better the design will be from an infection prevention and control perspective. If you don't, if you only come into the process within the last 6 months of the construction, and let's say the construction project is 2 or 3 years, you can still make some involvement with some infection prevention, but unfortunately, most of the decisions by that time have been made, and you're only making smaller decisions. For example, placement of hand sanitizer dispensers, sort of that type of thing. Maybe where you're gonna, if you plan to have some wall mounted PPE units and stuff like that, but the bigger decisions have already been made, and unfortunately, for the most part, it's too late. Unfortunately, so you want to kind of become part of that process. Unfortunately, continue to still see that not happening, and that's very unfortunate because that's not the correct way that you involve infection prevention and control into the construction process. I've been involved with a number of capital projects, and I've been involved from some of them right from the start, right from the design stage, meeting with the architect or designer, and I've been involved with it in a very much later process in other organizations. So, um, you know, um, there's so much to kind of think about here. Um, you know, right from the, like I said, mentioned briefly with the materials, you want to be involved with the selecting the materials, for example. Um, so it's, like I said, there's some major decisions that would be made, and some of them are more less expensive, I guess, in some ways, but still very important decisions. So there is a considerable amount of decisions that need to be made. So for the infection prevention control, and the more time you actually spend at it, the more benefits that you get from it right from the start. So you can be involved with it right from the start and not make enough of those key decisions, or you're not spending enough time with the process. So it is possible to be involved with it right from the start, but not make all the necessary key decisions from the start. That would be a very unfortunate miss if you have an opportunity to be part of it, but you lack the time to be part of it, or to uh, to think about what you want to do with the changes from a design perspective, from an infection prevention control. So if you do have the opportunity, you got to make sure that you build in the time to really spend time on the project and make those changes and do your research on those on trying to get an handle on the various levels where you can make and have an impact from the infection prevention and control perspective on the construction. So you really do get out of it the time and effort that you put into it from the start. So the more effort you put in, the better design from an IPAC perspective that you will have as the purpose at the end of the project. Um, so I think, kind of summarize it just quickly. Um, this one section is that, once it's built, that you've kind of locked in that risk. Sure, you can tweak and make some small changes here and there, but for most part, once it's built, um, very little is going to change. So, uh, might as well be honest that you know, uh, could be a few minor changes made after the fact, but for the most part, once it's built, once it's been signed off and becomes operational, and commissioned, then at that point you're already going to be making some minor changes to it from an infection prevention control perspective. At that point, the risks, as I've already said, it's kind of locked in. Very, very difficult to change it, and most likely it will not be changed. Due to the expensive cost of doing new construction, you're not going to finish it and then go back and totally redesign it. Healthcare construction in healthcare settings is extremely expensive. And nobody would have those kinds of funds or would approve for you to go back and and besides to do something like that, you'd have to close down the facility for the most part, depending on the size of the change, and that's just not going to happen. So can't emphasize enough the importance of actually building in the IPAC right from the start. So you're going to see me say that again and again because I really want to make that message clear that it needs to be built in right from the start, and you need to be spending your time on it, and the time needs to be allocated for. Otherwise, you won't get the benefits, even if you're brought in early enough. If you don't spend the time on the construction project, uh, so it's right from the like I said, meeting with the architect, tabling what needs to be, what you need to see from the design. The architect is going to meet with you and you go through like what are manufacturing prevention and control perspective. What is it you're looking for in the design? And it doesn't mean you're going to get, everything that you want, but you need to be going for, as much as you can, the bigger things, um, and hopefully that most of those things get built into the design. So you're right involved right from the concept before the architect even produces a first draft of any blueprints. These decisions need to be made, and you need to provide your input into it. Like I said, doesn't mean everything will happen the way you want it to go from an IPAC perspective or infection prevention and control perspective, but you got to put in the effort to try to get as much as incorporated into the design as you can. Uh, you know, and that effort that effort that you put into it will generate great benefits from an infection prevention and control perspective. So you want to be in there, kind of pushing for those key things and explaining. It's just not just explaining. Putting forward your ideas. You want to do that, but you have to be justifying and why you're proposing it. And if you get pushback on some of the design pieces that you're proposing for infection prevention control perspective, then I would say make sure you're doing the research, and probably better off doing that in a proactive way. Um, do your research, especially for the things where you think there might be more pushback from on it, from whoever. It could be from the leadership within the organization. It could be from the designer or the architect. So you got to be prepared to explain why you're proposing that particular idea, or why that should happen. So do your research, and because you can't just think it's just you're going to say something and everything is going to happen just the way you said. So you've got to be prepared to justify and provide the rationale and the reason, and support that with research from the literature. So you got to be willing to kind of get in there and do the research so that you got a solid ground for why you're proposing that particular design idea from an infection prevention control perspective. Still possible some things may get overruled, or regardless, at least you've put in the time and effort to try and do that. Realize that, you can't, there's only so much you can do, but you got to put your best foot forward and try your best positioning evidence for your argument or your position why this needs to be incorporated in, and then you'll stand the strongest chance that that actually occurs. Um, so there's only so much you can do, but you got to be willing to put in, like I said, the effort and do your research. So, um, I think there, whether using a couple examples, whether it's acute care, probably the most complex when it comes to construction and design, just due to the nature. So whether that's a smaller renovation or a large renovation or a new acute care hospital, uh, is probably the most complicated design. Whereas like designing for a long-term care home is not as complicated from infection prevention control perspective. So still, you gotta still be putting in the time and effort, but the design is not as complicated. An hospital, acute care hospitals is very complicated compared to like a long-term care home. So there's a lot of things that might be common, but the complexity of the design is what I'm taking over here. So um, there's so much, it's also not, uh, just it's not like your involvement from infection prevention control perspective. It's also not. It's also, I should say, evolves. During the construction process. So, you're involved making sure that. Let's give an example. Within, let's say there was a large addition to a long-term care home, or a large addition to an acute care hospital. You're involved with making sure that the residents or the patients are protected that are in the rest of the building, that's currently operating, that they're being protected from a variety of things, including construction dust, and make sure that no debris is being brought into the wrong areas, or the areas that where residents are going to be, as well as patients and stuff. So um, there's a variety of parts to it, and that's one where it's not just it is at in the design piece of it. You're there to ensure that the contractor is also knows what to do to protect residents uh, and patients that are in the part of the building, the healthcare setting that's currently operational. So there's a lot involved with that. So, um, well, in either of those situations, you want to make sure, like I said, the design, um, is you're being, feedback providing to that design, as I mentioned, right from the start. Uh, you don't want to be trying to make changes later on. Um, and it is, can't say it enough, this is why I'm going to repeat it more than once. It really, the best healthcare facility from an infection prevention and control perspective will, will result from the effort that's put into it. So the more effort you put into it, and the more time you spend on the design, as well as protecting, if it's an addition, protecting the current residents and patients. But the more effort you put into the design of the new healthcare setting or building, or an addition, the greater benefits that you will have. And I've already said, trying to manage it later is it sometimes it's just not possible. It's just not going to happen. You might get to make some small changes, but if you've gotten your design wrong, when it comes to the layout of your building, whether that's a acute care, a hospital, or long-term care setting. That's pretty much locked in. It's not going to change. So that's why you got to do your research, spend your time at it, talk to other people that's gone through the process of like or new construction or addition. Gather all your ideas of what things you want to propose, and like I said earlier, be prepared to justify, provide evidence why you think uh, the leadership team and the architect should go in that direction from an infection prevention control perspective. So um, I think there's many things that um, I think the even though I think we're not always doing the correct process of bringing infection control into it at a much earlier point. Um, I think uh, in some organizations they're doing it, doing a great job with it, whereas other organizations I don't think are taking that approach serious enough of bringing the IPAC in and right from the start, and the importance of doing so. So um, one of the things that I want to just briefly talk about, is the infection control risk assessment, so or the ICRA. Um, you know, it's it's often misunderstood. It's not like uh, a check well, a checkbox document is a process that takes a number of things into consideration. And two main things being, for example, if it was in renovation or major renovations, like taking what type of construction is being done. So it's broken up into various categories. So what kind of construction is being done? Is it minimal dust being created or movement of plumbing and stuff like that, electrical, or is it a major change? And then another part of that is the population at risk, for example. So again, I'll use an example. In addition, you know, it's a big difference whether you're making a change, to a maintenance room, for example, uh, there's no contact with, residents or patients, as opposed to an area like changes close to an OR, to operating room, um, to the surgeries or anywhere, a cancer unit, for example, making a change on that floor, for very vulnerable patients, for example. So you take those into consideration, the population that's at risk, for example, and, the extent of the project and what's involved with it. And you put those two together and you come up with like a matrix. And then it's that matrix, those cells within the matrix are assigned uh, an infection prevention and control number that kind of dictates the amount of preventive measures that you need to take from an infection prevention and control perspective. So that's kind of like how that FICRA works. It's not like a checkbox or anything, check document and stuff like that. There's many things that are taken into consideration, as well as once you figured out where you're positioned on that matrix, taking the population at risk in consideration and the scale of the construction project, that dictates and determines the IPAC measures that would be taken. And that's kind of the outline. And you would outline everything that you're planning to do in the infection control risk assessment or the ICRA. So, I think, it's not like it's also, I should say, it's like a working document. It's going to be, it's not like you're going to do it and it's not going to change. Like you're going to make some additions to it, as the situation changes. And then, some of the ITAC preventive measures that you need to take might also change. So it's kind of got to think about it as kind of like you want to be revisiting a variety of milestones and seeing if you need to make any adjustments. So don't think of it as a one time um, document that you're going to create and you're just going to leave it. It's very much like a working document that you're going to look at many times of like various milestones during your construction process. So um, let's just talk about um, some of the design decisions and why they matter so much. So you know, um, in some healthcare settings, depending on the size of the building and everything, some of them are like small, small decisions. Well, it's like they're very important decisions, but it's good something that you can change pretty late in the process. So even if you miss one, so for example, hand sanitizer placements of the unit. So um, you want to build that in right from the start, and there's depending on the size, there's going to be hundreds and hundreds of the dispensers throughout an healthcare settings. It could easily be whether if it's a new building, it's going to be well over 1,000 likely in the healthcare facility for a new construction, for example, long-term care setting. Um, but you're going to spend your time and effort and figure out the workflow and where those dispensers are. It may seem like a minor decision as opposed to a major one, like going with single rooms for residents or patients. So it doesn't have that kind of scale of impact, but still, there are very important decisions to be made, and you got to make very many, a lot of them to figure out how the workflow is going to work within that setting and figure out where you want to place them. Um, and you want to put that time and effort in there. But if you miss a few, there's no significant implications that you can add those extra placements for those dispensers, or you can move one or year, but you want to be putting in that time and effort to get it right. So you don't have a tremendous amount of work to do at the end. You just got to do some tweaking. Maybe there's a couple that you've missed here and there. I've gone through that process with the dispensers and spent the time on the work flow and trying to figure out, how staff are going to use this new space and where those dispensers need to be located. Everybody or a number of people are going to have different perspectives, even from infection prevention control, about where they might want, people look at the workflow a little bit different, and that's fine. I think the most part people will agree on the locations. But not going to expect that everybody's going to agree on two IPAC professionals are going to agree on exactly every placement and sanitizer. So everybody's got their own individual opinions. But like I said, you can tweak those and make those small changes at the end. If you missed any, and you will miss some, but the more effort that you put into it, the less of that's going to happen. You're just going to make a few minor ones. And you got to check, which I've done for a new construction project. You got to go back and check the work. I can't emphasize this enough. Just because you outline where things need to go, using this example with the dispensers, doesn't mean they're all going to get done the way that you laid out to the installer. So you need to go back and check it and make sure that and it can be time consuming for sure, but you got to make sure that it's being the design changes, or in this case, just the placement of dispensers, have occurred the way that you've outlined, and the installer has gotten it correct. So, um, you know, so the thing about this is, using this example with dispensers, is just that you want that kind of given rationale is that you want those dispensers at the point of care, and then visibility is so important. The better access the staff have to the hand sanitizer dispensers, the more likely to use it. And You could say the same for the placement of any PPE dispensers or units that are being used to store supplies, either in acute care environment or within a long-term care setting. So, um, I think it's important to be, be putting your effort into it. Not only the big design decisions, but the smaller ones as well. So, um, and some of the bigger ones, would be the HVAC system, for example. Um, as well as like clean and dirty pathways, for example, is another example. So there's many parts that and components of your infection prevention control are going to be involved. So, um, and I guess to kind of like a quote, you can't, once it's been, the floor plan has been designed and built, uh, you're not gonna get that change. So, that's why you need to be putting that time and effort into it. Is So some of the other things want to talk about um is the material. So this I've seen this fortunately done incorrectly. Is is every And this is why IPAC has got to be involved with all components of the construction process, all selection of materials, all the selection of the furniture that goes into it. And that's a considerable amount of decision making that needs to be made. But um, I've been part of a process where it, it's clear that the design is um, is overruling the IPAC things that need to be done from the IPAC perspective to protect the residents and the patients as well as the staff. I want to forget the staff was so important. Well, protecting the staff. So we can't allow you shouldn't be currently where um the design is coming before um the importance of the IPAC um decisions or requirements, I guess, for the new construction or in addition for the healthcare facility. So um, there's no point in having a new healthcare setting or an expansion that looks really good, but is very poor from an infection prevention and control perspective. And whether you think about it from an outbreak management point of view, whatever direction you come from. Um, if it looks really good, but then that um, IPAC has not been incorporated in, or hasn't been considered, or requirements that you've laid out have not been taken serious, then you're going to end up with a healthcare setting that looks really nice, uh, but come but it comes with considerable risk because the IPAC pieces have not been incorporated into the design. So you have a nice facility, but it pushed the staff, uh, the residents, and the patients at considerable risk from an infection prevention and control perspective. So that's why it's so important, um, you know, for the IPAC pieces to be incorporated in. I'm not saying everything will be incorporated, but there's so many things that need to be incorporated in order to provide that, reduce that risk and provide that protection. And you can still balance it in terms of the design. I'm not saying the design is still not going to be like making it look really nice, still not going to be incorporated in. But you want to make sure that the IPAC pieces are being covered. Um, so we're going to talk about that's one thing. You know, Another thing is like you want to make sure I've already alluded to a little bit the material. So you want materials that are non-porous, so you're not getting things in those little holes. Microorganism a great place to when you have a surface that's very porous. That's a great breeding grounds for the pathogens. and very difficult if it's porous. It's very difficult to disinfect. So that's why you want those seamless materials, non-porous, very durable surfaces. That's another thing. Then it's got to be able to handle, a great deal of disinfecting on a day-to-day basis over many years. So you don't want things that's going to be materials that are going to be breaking down um, because of repeated use of disinfectants, for example. So um, another thing is the furniture, and so there's you need furniture in any of the healthcare settings that's cleanable, can be wiped out. So if you buy furniture, that's fabric and it can't be wiped down, that's not a good decision from an infection prevention control perspective. You need to be able to have some select materials, furniture, using long-term care, for example, where it can be wiped down. It's going to get a lot of use, and you need be able to disinfect uh, that that furniture, those chairs, those dining chairs, those lounging chairs, repeatedly throughout the day. So that's why the furniture needs to have a bulb selection of it, and you got to voice those concerns and make sure that the right furniture is being selected. Because I've seen it not happen, and you end up with a new healthcare setting, and you can't disinfect the furniture, and that's a major miss from an infection prevention and control perspective. And I'll be talking about the finishes. So every piece, you know, of the materials need to go through and have an involvement from an infection prevention control professional to go through it and to sign off and give approval on the materials. Because these, even though it's an healthcare setting, doesn't mean the architect's going to be aware of all of the various things that need to be, why that particular material is not a good idea from an infection prevention and control perspective or from an IPAC perspective. So, um, you want to be involved with all that, and that's why you start to get an idea. Um, as I talked about in this episode, how many decisions IPAC or infection prevention control need to be carried out, and you start look at it. It is no small task, and that's why it's often requires people from an IPAC perspective that that's what are specialized in or where their experience is, because there's so many decisions that need to be made. Often, even people that are working in IPAC or infection prevention control are not familiar with, because they haven't gone through it from that part perspective from construction and infection control. So um, you got to sometimes bring in that expertise if you don't have that within your organization. Some organizations are big enough that they have that expertise, and there's enough construction projects to justify that kind of uh, position, whereas smaller organizations don't have that or don't have that expertise. They might have it at an organizational level, like a bigger, but they may not have it at that site level where someone could provide that kind of input. So, um, there's so much to take into consideration there with that. Um, the other thing I guess I want to point out is, these decisions, um, you're making, like Liz said probably a few times, you're making so many decisions. If it's done right, and you're brought in from the very start, before the architect even provides the first draft of any design, you got to be well into that process for that. But one of the things I probably can make clear is that those decisions, especially those bigger ones, and I'm not referring to like the placement of some of the hand sanitizers or dispensers, but some of those bigger decisions, are going to have an impact on the risk for decades, for most of the use of that facility. Um, so that's why the ramifications and implications of that decision making from an infection prevention control perspective is so important, because these are not things you can easily change in 3 to 5 years. These are things that are going to be probably, for the most part, locked in for 40 years, for example. Probably for the most, the uh, lifespan, I guess, of the building, and how long it's going to be operational. So you don't want to lose track of that. That these decisions you're making, say, are there for a long period of time. So um, and I guess if I've kind of, we're moving on to the next section. If there's one thing kind of wrap up, um, this section, if it can't be clean, I guess it can't be clean and disinfected, then it doesn't belong in that healthcare setting. So say that again. So if you can't clean it, disinfect it, then it doesn't belong in an healthcare setting from an infection prevention control perspective. You got to be able to do both of it. It's not just the disinfecting. If the um, you know if there's, for example, the countertop selections and whatnot, if there's trouble, if there's a lot of food on it, or not, you got to be able to clean it off first and get those that off of the countertop, and then you got to be able to, once you cleaned it, remove anything that's then you can disinfect it after. Right. So it's a two-step process for the most part with that. But that's why the materials and selecting those appropriate materials is so important. Um, Going into the next section, I did want to talk about the importance of designing for an outbreak. Outbreaks, uh, need to do everything we can to design healthcare settings that reduce the risk of outbreaks. So, and you do that, say it again, right from the start. So, the design makes a major um, implications in terms of the outbreak risk. So that's why you want to make sure you're designing for an outbreak, and that includes, I know, those pandemics as well, which we went through that, and saw how much impact that the layout, for example, long-term care was it so hard in Canada, well, globally, but using kind of example that, one of the reasons is that these, for the most part, long-term care settings, for example, were not designed to handle pandemics and outbreaks. So from a design perspective, from an infection control, they weren't designed in that way to reduce that risk. And we need to be building new healthcare settings that reduce that risk, not make it difficult from an IPAC perspective to manage the outbreak. And the design of the facility has a tremendous impact on the risk for outbreak. So you got to make sure you're designing for reduce that spread and that transmission of infectious diseases within a healthcare setting. And a lot can be done just from the design perspective. So, uh, you know, I guess one way is to put it is you want to be, um, you're not just designing for like day to day operations, but um, that when you do design from like a day to day normal operations perspective, you're still um, going to be reducing that transmission, that spread between resident to resident, residents to staff, patients, patients to patients, patients to staff, healthcare staff. Um, so you're going to be designing for that, but you're going to be able to design for those surge times when you get several cases on a particular, say influenza on a particular floor, and those key design decisions, um, are going to have implications. They're going to considerably reduce, if you've done it correctly, reduce the risk for outbreaks in a healthcare setting. So, um, you're going to be doing a good design will reduce the risk of spreading pathogens day to day in normal operations, as well as during when there's a surge or increased cases on a floor, as for like that could result in an outbreak. Design A good design is going to reduce the. It's not going to guarantee you that no outbreaks are going to occur. I don't think that's possible, but it's going to reduce the. A good design is going to reduce the duration of an outbreak. So if you got shared rooms with residents in it, for example, um, increased risks of outbreaks happening within that type of healthcare setting, as opposed to an healthcare setting that's got single rooms for residents, for example, or for patients. So anything that's a shared space comes with risk. One like for the sleeping accommodations, for example. So um, you want to be able to um, again, this comes second design. Um, the units, I'm going to use long-term care as an example, that can be isolated. So you don't want a particular unit or community to be too large, because then trying to want to design it with smaller areas for residents that's easier for you to contain. So again, it's very important, like from a design perspective, that you don't have like very large open spaces or sections for where residents are sleeping, because that's going to make it much harder for you to contain that outbreak. So you got to make sure you got smaller spaces that's more easy to contain, and then your chances of containing that outbreak are going to be higher, or less likely to have an outbreak. So even if you've gotten one or two cases and you're on that line of possibly having an outbreak, then having smaller units will make it easier for you to reduce that transmission. And then you may be a couple things less likely to have an outbreak declared. Uh, and if an outbreak ends up being declared, then you're in a much better position to get out of an outbreak, um, at a sooner point. And that's the goal. You don't obviously first goal, we don't want outbreaks to occur at all. But if it does, you want to try to get out of outbreak as soon as possible. And that design of that healthcare setting, in this case, an example of long-term care, that design is going to make a significant difference in whether that risk goes up or down based on the design of that setting. So, um, you want to be isolate those units more quickly. Um, you know, the, the and the I think the HVAC system is so important or often gets missed, but that's extremely important. The airflow, the air exchanges, these are things that uh, infection prevention control get involved with. Um, so there's many things that involve IPAC and non-IPAC perspective. Um, I think you want to make sure, I guess, another thing to kind of just wrap up this section is we want to make sure that you got flexibility, you got say, and for infection control perspective built into the design. It's good to have that, some flexibility, so that you can make some minor changes here and there as well. So, um, now moving on to the next section is, commissioning and occupancy of a new healthcare setting. Want to talk about that for a little bit. Um, there's so much involved with it, and it is a complicated process. There's so many things involved before, whether it's an acute care hospital or a long-term care home. You know, it's not going to be you're not going to get those approvals and signed off for for those buildings, for those settings to become operational. There's going to be so many inspections that need to be done. Same as from infection prevention and control perspective. A lot of inspections that need to get approved by public health, for example, from the ministry, for example, Ministry of Long-Term Care. So, you're not, you got to make sure that you're putting, again, I can't say it enough, you make sure you're putting that time and effort into the design right from the start, like I mentioned, right up until you get approval and pass all those inspections. You got to be working on going through that healthcare setting, leading it right up as these inspections are occurring, and making sure that you're picking up on anything that may have been missed from, say, in this case, from infection prevention and control perspective, and fixing those. You're going to be spending considerable amount of time at that setting, and like, for example, I'll use it for a new building in long-term care. It's not just going to be like into the facility for an hour and out. So you got to be putting in a considerable effort right from the start, right up until you're getting occupancy, to this example, moving residents into a long-term care setting. And even then, when you're moving residents into a long-term care setting, you got to be making sure that everything is being done to protect those residents that are moving into this new long-term care setting. When you got a lot of people coming into the building, it's very exciting. It truly is. But also, there's a lot of risk because you got a lot of people coming into this new building, especially on those moving days. And you need to be making sure that everything is occurring and everybody is doing everything they can, doing the hand sanitizer, wearing their PPE to reduce the spread, because you're going to have with that comes with a lot of risk, because you got so many people coming in, moving around this out within your long-term care setting. And I've gone through it where during doing the move, which you think you don't want to occur, but it did occur, is that had an open outbreak occur for influenza, a week before, right, a week before the move day. And then you got to be prepared for all those things, and make those adjustments to reduce that risk. So, for example, um, you know, you don't want to be moving during an outbreak, but it does occur. It occurred, happened to myself. So you need to be making those changes in your plan, your moving plan, so you're not putting other residents at risk during the transportation of residents from the current building into the new building. So in that situation, what I did was actually moved anybody that was still still infectious, move those last. So they were isolated to their rooms, and stay there, and then moved all the other residents first, and then anybody that was symptomatic and still infectious, then they were moved at a separate bus. They were the last people to be moved, and then everybody that was in the bus with them, they'd make sure to be doing a hand sanitizer, as well as the other buses, but make sure they're wearing a hand sanitizer, the masks, for example, during the transport, as well as other PPE. So you got to be prepared if you make those adjustments, right when you're getting to the point, in this case, for myself, in occupancy. I had to move residents. I had to do the relocation of residents from an old building to the new building during an outbreak, which can happen. It did happen to myself, being an infection prevention and control manager. So not ideal, makes it more challenging, but that's the way it can go. So you gotta be prepared for that. There's things don't always go the way you want it to go when you get to that point. But anyway, I don't want to um, you know, on want to give a clear perspective of the amount of work that goes in it right from the start, right up until occupancy. And then, like I said, you got it. Then your shift. You gotta make sure you're protecting the residents. I know it's um, moving day when you have like a lot of people in the building, for example. So, and I guess that opening day, that's going to be your first infection prevention controls stress test. I guess I should say. So it's going to be your first time where you're going to start seeing all your decisions that you've made, how it's being played out, and there's still going to be things that you've missed. But I've already said the more effort that you put into it, the more benefits that you're going to get. See, nothing's going to be perfect. You're still going to make some changes, and there's still, but the more effort that you put into the decision making process, and effort you put it right from the start, right up until moving day, the more benefits you'll see more benefits from that, putting all that effort into it. So in closing, wrap up this episode. This first episode, part one of IPAC, or infection prevention control and construction. It's going to be a 3-part series. I wanted to do this part one to kind of be more general and start to get the conversation started on so many different areas. And then I'm going to do a part two and a part three for this series, construction, and for IPAC, where we'll get a chance to get into some of these topics at a deeper level. Um, so looking forward to kind of getting this episode posted on the platforms, and then working on a couple more parts 2 and part 3. Um, so if I had to give one message, make sure that one final takeaway is just make sure that IPAC is at the table from the very start. I can't emphasize that importance of that enough. It needs to be there right from the start. I want to, you don't want those risks being built in, and then you can't change it. So I want to thank you very much for joining today, listening to this episode. Like I said, there's so much there's so much to consider. But I want to thank you for joining today. Like I said, my name is Wayne Tucker. I'm the host for the Infection Prevention Control, or for an Infection Control Exchange podcast. Please take some time to um, listen to the episodes, listen to the series, parts 1, 2, and 3, and share the episode, or share this on your social networks. I'll be doing like I said, I do the announcements via LinkedIn post, and then I share all the links, Spotify, Amazon Music, Apple Podcasts, and YouTube links, in either in the comments or in the main LinkedIn post. So please share it within your networks, within all those platforms if you use them, as well as LinkedIn. So looking forward to working on the parts 2 and 3 of the series. And thank you very much for joining. Like I said, my name is Wayne Tucker. I'm the host for the Infection Control Exchange podcast. Thank you.